We have Pam, Ernest, we have Christine, Penny, nice to meet you. I know Bethany's here, Ernest, and Simon, and Bumi, thanks for joining. And I think that is everybody we have today. So it's 4:05, and we can go ahead and get started. Just pull up my agenda on my computer screen, and I'll just walk through it. So we'll start off the meeting with introduction with everybody, and then we'll appoint a secretary for the meeting minutes, and then we will review and approve the meeting minutes from our January 12th meeting. And then we will have a presentation and Q&A with Penny from the Rhode Island School for the Deaf. And then we can move on to a project update or topic we would like to talk about. And then if there's anybody else from the public who had a comment, they can share. And then we will schedule our next meeting and then wrap it up. And I'll go ahead and get started. I'm Brett Hayes. I'm a commissioner on the board, and I am the chairperson for the healthcare committee. And look forward to enjoying today's meeting. And then anybody want to go next? Ernest?
Yes, hello everyone. My name is Ernest Covington III. I am the executive director for the Rhode Island Commission for the Deaf and Hard of Hearing.
Welcome, Ernest. And Pam?
Hi, I'm Pamela Zellner, program manager here at the Rhode Island Commission for the Deaf and Hard of Hearing. It's good to see all of you.
Thanks for joining today. Bethany?
I'm Bethany Lake. I am contract project coordinator for the commission. I've been here about 2 years and happy to help.
Great, thanks for joining. And then Christine?
Hi, good afternoon, everyone. My name is Christine West, project manager for Healthcare System Transformation Project, HSTP, with RICDHH. Welcome, Penny.
Thank you.
Thanks for joining, Christine. And Penny, how are you?
Hi everybody. I'm Penny Bailey, the nurse at the Rhode Island School for the Deaf, and nice to see you all.
Wonderful. Always good to have somebody from the School for the Deaf. And then I think we have Lucy Cruz.
Lucy Cruz, you said, Brett? Lucy?
Hi, Lucy, how are you? James joined us today. How are you?
Good.
And then I think I also see Bumi. Nice of you to join today, Bumi.
Yeah. Hi, everyone. I'm Bumi Osho. I'm a member of the Health Committee. Nice to see everyone.
Thanks for joining today. I know Mondays are better than Tuesdays for you, so I really appreciate you being able to come today. And I promise you will accommodate and try to do a Monday in the future.
Thank you. Thank you. I appreciate that.
No problem. And I think I just about covered everyone who's in the meeting today. Thank you for joining. And then the next part of the agenda will be to appoint a secretary to record the meeting minutes. I'm happy to continue with that as long as I'm able to get the transcript of the meeting from Bethany. All right, thank you. And then now, if I can just ask Bethany, if you could pull up the January 12th meeting minute. And for those of you who want to read it over quickly and see if there's anything I may have missed or putting incorrectly, I believe I captured everybody who was at the meeting and who from the public attended. And I believe it was shown and Simon that I would, at the last meeting as our interpreters. If I was wrong, please correct me. I don't know if you have a specific service provider, a vendor that we might need to record for documentation. So I'll just quickly walk through it. I started with bullet point number 3. I made revision to the December meeting minutes, and I sent a final draft to Pam at that time. And then we had 2 ladies from the Rhode Island Executive Office for Health and Human Services. They were very resourceful. They presented the project ecosystem around using data with Rhode Island demographic and how it can be leveraged. I made some very high level bullet points. If there's anything I may have missed, please let me know. And then we had progress update from Christine and her team. Dr. Lynch also joined the meeting. They mentioned that they had sent a proposal to the Department of Labor, and they had a pending curriculum tentatively planned based on how the progress of the COVID vaccination would go. Obviously, a lot has happened since then. Things are improving much better. So maybe in the future, we can get a better update on that. And then Ernest took over and he talked more about the vaccine program and the bottlenecks that our community was facing and working with the governor's office. And then Christine had provided that Gallaudet surveys were completed. And at that time, she was expected to get the survey result. We'll find out more about that later in today's meeting. And there was also an update that we received a no-cost extension related to the project that can go out to the end of calendar year 2023 with the current funding. And Alex and Christine are our main project leaders. And at the time, Christine had mentioned they would be working on a consolidated final report throughout this year. And we kind of walked through some quick goals and objectives for the calendar year 21. A lot of it was around the interpreter training program, offering virtual training, community outreach, and I believe Alex was working on the website. And then I think we just about wrapped up the meeting at that point. Now, Christine, Ernest, is there anything I may have missed from what you guys discussed? Feel free to add input or shoot me a note after the meeting that you feel is important to get on paper before we submit it.
Ernest saying, I believe everything's in order.
All right, thank you. Christine?
But there were a few things that just need to be revised, but as you said, I can send those to you
Yeah,
via email if that's helpful.
Okay, yeah, sure. Thank you. Well, if that's the case, I'll just hold off on submitting it until I talk with Christine, and then I'll review it one more time, and then we can likely submit it. No hurry, next few weeks at most, but sooner than later. Okay. All right, thank you. All right, Caroline, nice to see you today.
Hi, sorry I'm late.
No problem. How you doing?
Good. Want me to turn off my mic?
Oh, no, that's fine. Whatever you prefer. All right. The next part of the meeting is presentation and Q&A with Penny Berry from the Rhode Island School for the Deaf. Penny, nice to meet you again, and
Yes.
really looking forward to you sharing your view to the team today, and then have a discussion afterward and how we can be of assistance.
Okay, great. So hi again, and thank you for Christine and Brett especially for inviting me to this meeting. I'm very, very happy to do this.
Hold on a second. Can everybody turn off their video while Penny's presenting? So it's easier because this way, when we record it, the public will have access to the interpreter as well as Penny.
You're all set, Penny.
Okay, so I'm going to share my screen.
Give me just a moment and I'll
Yep.
give you that.
Yep.
You're all set.
Okay, great. Thank you. I'm hoping this will work because I wanted to use my laptop, but I can't get any service here at school. So just tell me, can you see this? Because I'm not sure if you can.
We are not seeing screen sharing at this time.
You can't see it? All right, I was a little concerned about this because I don't usually do this on this computer. And when I go, hold on a second, just let me figure this out. When I go to share screen, oh, here it is.
There you go.
Now you got it?
Got it, but you're gonna need to,
Yeah, I just have to find it. Hold on.
there we go. There we go.
You have it now?
Yep.
Wonderful. Okay, great. It's just this computer works differently than my laptop. So, okay. So I did this project for parents at the School for the Deaf because I wanted to get a handle on where they were, from their perspective of using an interpreter at medical appointments specifically, because I'm a nurse. And I noticed that a lot of students go to the doctor, they come to me with a concern, and then they go to the doctor, they come back, and I ask them what happened, and they have no idea. So they said, yep, my mom and my dad just talked to the doctor, and I just sat there. So I thought I would delve into that more. And I'm also doing it as part of my master's program at my college. So it was something I've been interested in for years and years and years, and this gave me the platform to do it. So I'm very happy to share. So it was called a community learning topic, and to just begin the flow of ideas with the parents about their perception of how to use an interpreter. And then I had learning objectives. I'm not going to read the whole entire presentation to you because it's way too long. But I wanted the learning objectives for this to tie into the School for the Deaf so that we're in alignment. So basically, the most important thing was to recognize that students need access to communication in their preferred mode of communication. And for them to understand what was being discussed, compared the difference. So parents really had an idea of comparing the difference between going to an appointment with access to language and without access to language, and how to follow a plan, what to do. And then I had some vocabulary because a lot of parents aren't familiar with these terms. So access is to enter or connect. Of course, American Sign Language. The word effective means useful. And then I just covered the many different kinds of healthcare providers that there are. And what is a health outcome? What happens as a result of receiving healthcare. And outcomes is the way things turn out. And then the School for the Deaf's mission statement. I just have to move here. Okay. And so, again, that it was just in alignment. And for some reason okay. So nursing also has goals. And the mission of nursing is to optimize student health and learning. The vision is that all students are ready, healthy and safe to learn, and to achieve, we want to improve school community and student health outcomes by building a culture of health and decreasing barriers to health. Okay. And a barrier is something that blocks access to service or understanding. So things that can contribute to communication barriers. I loved this photo because this is often what happens, to everyone when you go to the doctor. Someone sits there and they start talking to you like you're just there and you're not really, that important. So unfortunately, that's the way it happens a lot. But lack of adequate interactions, as is very visually apparent there, between the doctor or the clinician and the patient, and that can include language, literacy, and cultural beliefs. And in this case, lack of appropriate interpreting services. There's many cultures when you go to the medical appointment. There's that of the patient, the provider, the system of medicine, which has its own culture, and then there's the deaf patient culture. So in deaf culture, ASL is the preferred communication. It is not a mix of English and sign, but yet it is a complex and complete visual language. Then I just had some thumbs up, some thumbs down, just for some interaction with the families to keep them engaged. And so, deaf students need access to communication in a preferred mode at medical appointments. And they were all very eager to say yes, which was great. And when access to healthcare is limited because of language, people feel not listened to, not included. There is no opportunity for them to ask questions or disagree. And just because they are quiet doesn't mean they agree, but a lot of physicians, aren't aware of that. They just think, okay, they didn't say anything, so everything's fine. And also when there's no communication, it leads to underreporting. People don't tell the doctor what's happening, so a correct diagnosis can't be made, and the proper treatment often isn't initiated either because they don't know what's happening. One in 9 people don't have a good handle on health information as it is, and that's just the general population. And so, because medical terminology is very complex, so if you can't understand it and you don't get it from a reliable source, it's very difficult to make appropriate decisions. And a language barrier and lack of adequate communication cause the gap in health knowledge for people that are deaf. So when someone has a problem, they go to the doctor, no idea what the doctor said, don't know what the problem is, don't know what the solution is. So essentially they still have a problem. without access to communication. Okay, and then a child benefits when they understand what is being discussed. Yes, of course. Clear communication is the best outcome because it reduces fear and mistrust, reduces avoiding going to the doctor, which happens a lot when people don't understand, and they're not going to know what happens, what's the point of going, and it allows for them to be included in making decisions. There is a positive association among these three: quality of life, mental health, and physical health. And research shows that barriers can be defeated by creating awareness of being aware that deaf and hard of hearing are a group that requires specialized attention, and that is step number one in making an improvement in health outcomes. And it doesn't matter on someone's level of signing, but rather that they are able to use it. And effective healthcare includes respect, curiosity, and empathy. Let me just find my page. So in the early years of a child's life, the focus is more on meeting the needs of the parents. Then the child goes to school, learns to sign by leaps and bounds, and most times, unfortunately, the parents do not keep up. And since one of the purposes of this presentation was to identify the communication needs at medical appointments, and that it was necessary to, because of that, it was necessary to have an understanding of the parent views of deafness, hearing loss, and communication. And often parents are not even aware that an interpreter can and should be provided by the doctor. They're used to being the caretaker, and also, unfortunately, they're used to people not being able to sign with them or their children. I sent out a questionnaire to 58 people, and I got 20 responses, which I thought was pretty good. It's nothing like the Gallaudet questionnaire, but their voice and their input is extremely important. And I asked these questions. I did some research, and I also went over them with Christine to, ask questions that were relevant to the parents. So more than 90% of babies are born deaf are born to hearing parents. 95% of parents knew that. And what does that mean? That means that there are unique challenges to the parents. They haven't navigated healthcare in this way before. There's lots of unknowns, but the parents are the experts and the key to getting children's needs met. 100% of the parents that responded had a primary care pediatrician, which was wonderful. 90% said that it was very important to them that their child knows what is happening at the doctor's appointment. Yet, how does your child communicate at the doctor's office? 50% said the parent communicates. 15% no communication from the child at all. 10% use voice, and 20% use a combination of sign and voice, which was very interesting because the parents, 90% said it's really important to them. And they know how to ask for an interpreter. 45 yes, but 55% no. and the pediatrician provides an interpreter, look at this number, only 15%. So that means 85% of the appointments that are happening with the respondents, there's no interpreter. So the child is just sitting there, no idea. Other specialists provide an interpreter. I'm really not sure how valid this is because it wasn't, a really specific question, because I think some parents just said yes and really not realizing that it probably isn't so. So 45% did say yes. And the language the parent feels most comfortable using, 65% was English, 15% Spanish, and 20% was a mix of voice and sign. And the child's ages were 6 to 18. So those were all the questions. And then at the end of that, awareness that deaf and hard of hearing requires specialized attention is the first step to improving outcomes. Of course, the answer is yes. And the parents all did answer yes eventually. Now this is Nathan. He is our athletic director here. And I asked him to share his story about growing up in the going to the doctor, like with the medical community. So here's his story. Okay. So Nathan talked about writing notes, which happens frequently, at least according to my students. It is not recommended, however, unless it's going to be a really short visit, like a flu shot or something, because what if something needs to be talked about? You know, it can't be. And we are trying to increase awareness so that that does not continue to happen as an accepted way to communicate. Okay, so what is an ASL interpreter? Because a lot of the parents, you know, don't use this often, so they're not familiar with it. It's someone who's highly qualified and can break down barriers to improve comfort levels, working with people that have different cultural needs. They convert spoken language to sign and are skilled in expressive and receptive language and use specialized vocabulary to ensure clear communication. Interpreter gives the patient a voice about what is important to them, can determine what the patient is understanding, and the accommodation for access to communication is getting information from a qualified ASL interpreter. Why is an ASL interpreter needed? Provides a positive healthcare experience, provides information and people can participate and understand the information. There is a sense of privacy, increases the quality of life, and promotes better health outcomes. They also bridge the gap so that the patient knows what's happening, have an opportunity to ask questions, identify thoughts, and less frustration. And allows the parent to be the parent. And now here we have David. He will explain his story growing up. Hold on, coming. Doesn't seem to want to go to the next slide. There we go. Okay, so there is a difference between going to an appointment with access to language and without access to language. Yes, of course. And this was interesting because you could see a few eyes light up after that video, especially. And video relay interpreting. Oh, it's video remote. You know, I had a newer version of this, but anyway, video remote. It's not for everyone. Sometimes the screen is far away. I know with COVID, you know, a lot of times this is being used, but if someone does want an in-person interpreter, it is their right if they have an in-person appointment. Education is needed to break down barriers. There's no guarantee that any one single intervention will improve access, but if we don't try, we can't go forward. It's important to understand how to use interpreters appropriately and also for physicians to be comfortable working with patients that use sign. And research results conclude that education is needed how to be effective to produce the desired result of improved outcomes, by making patients autonomous. So understanding healthcare leads to better success and empowers positive health. The right language is essential for understanding. And I let the parents know that it's okay if you have to explain to the office staff that, you know, an interpreter needs to be secured. And as healthcare is increasingly complicated, it's a priority to make sure that their child is understanding what they need to know, as like David said, to set them up to be empowered for positive health outcomes as adults, and to understand a very sophisticated healthcare system and to be able to navigate it independently. And then ways to improve access to healthcare is increase awareness. Because if people aren't aware, they don't know, they just keep accepting that it's okay to, you know, to have lack of communication. So educate about effective communication, provide ASL interpreters so the patient has a voice, and have materials in appropriate language and pictures if necessary. And I also explained to them that they could ask the doctor to give them a patient satisfaction survey. And that might raise some eyebrows. So to increase awareness, hospitals, you know, like even Hasbro has interpreters. We had a mom who had a student of ours in the hospital not that long ago in the fall, and, you know, deaf, and the mom stayed to communicate. And she went down to the cafeteria to get something to eat, ran into an interpreter, and the interpreter said, "What are you doing here?" And she explained, and she said, "Oh my gosh, we didn't even know your child was here." So just because a hospital has an interpreter doesn't mean that the staff know that. So the interpreter icon, you know, is a good indicator to keep on the health record so that it gets transferred throughout all departments and that the staff knows that that needs to happen. It's a simple thing, but it's super helpful. And communication is for everyone because a lot of the parents need interpreters too. And they wanted to know, you know, can we have an interpreter and our child have an interpreter? And yes, they can. And it benefits because both the parent and the child understand what is happening, and they can share the importance of access to language. And of course, you obviously know about the commission pushing for legislation for interpreting to be covered by all insurances, currently stalled, of course, due to COVID. And it seems many healthcare providers' facilities, despite it being a law, still don't get that it's their responsibility to secure an interpreter. And your own Christine West did an interview with Dr. Moreland, and I only put it there for a reference for the parents. I did watch the entire thing, and it was very profound. And the highlight was that the patient is the most important person in the room. And research shows that in-person education increases the use of interpreting services among healthcare providers. Involvement of community members and families is needed to expand understanding of barriers to communication, and being an active participant can implement change. So I made this infographic so that, and I sent it to all the people that participated in English and in Spanish, because we had a separate Spanish and signed presentation. And so they got the steps of how to contact an interpreter and to, share with physicians' offices. And I also made one.
I love Spanish. It's so ethnic.
I made one for hopefully the you guys too, that we can share with physicians' offices, practices, hopefully in the future. Because medical professionals need to be made aware about communication needs for deaf individuals at medical appointments. Most definitely. And then I just gave, that's just a bunch of information, and our own John Henry interpreted everything for us. So that's the end of that, what I showed them. It was a lot longer. I spared you. So I don't know if you have any questions. I'd be happy to try to help if I can.
You should be able to unmute yourself now, Brett.
Can you guys hear me now? All right. Well, thank you so much, Penny. That was really great. It's always good to get the perspective of the students themselves, especially the struggle they have trying to understand their medical appointments for their own bodies, and some of the limitations that they have with their parents kind of taking over the appointment. Is it something that you surveyed the whole school, or to a specific grade?
I sent it out. I didn't, first grade and up. Not the students that are have a lot of hearing, the ones that would benefit from an interpreter. And I, went over that list with our interpreter too, to see which ones would benefit and which ones wouldn't. So it ended up being, because we don't have a big, school student body, it ended up being 58. And I got 20 responses, which I was pretty happy with, because here we don't tend to have real good parent participation, So I think it represents a pretty good perspective of theirs.
No, that's great. Is it something that was shared with the parents as well, to kind of educate them about how they
Yes.
feel?
Yes, I invited all of the parents that, that I sent the survey to, invited them all. And I think we got 16 people that came to the presentation. So, and responded to the evaluation questions too, which also weren't on there. I had a newer version, and for some reason, because it's on my laptop, when I switched it over to this is the version that I got, but there's also evaluation tool at the end for learning. And I wanted to know if they had more confidence after, or that I had more awareness that they needed to ask for an interpreter after this presentation. And they said yes. And did they have more confidence? Yes. And how likely were they to ask for an interpreter? And it was like 80% likely that they would. So not 100%, even learning that it was necessary. Because a lot of them don't communicate with their children, or don't know how to. So it's
Right, yeah,
Yeah, it's
especially younger,
difficult.
where the parent would want to make sure the parents know what the children should be
especially
capable of knowing.
exactly, especially so many of them. Oh, yeah, we want them to know. But so there's definitely a disconnect there between what they, say they want and what they really understand about how to go about to get.
Right. And I saw in your presentation, you mentioned one of the bills that are in the Rhode Island legislation that's being stalled. I can't remember off the top of my head, which one was it that you had pointed out? Because
I
if that's
don't
something
know.
that we need to advocate more,
Right.
maybe as a,
I don't know the name of the bill. I talked to, is it Holly at your organization, I think, and she said that
Okay.
legislation was it was on hold to try to get more insurance companies. Yeah. on
right,
board.
yeah, okay, yeah, that's becoming familiar now. Yeah, I mean, I can talk more with her about that.
Mm,
And like, as a committee and as a commission, if there's any bills and legislation that we as the deaf community know that we need more support on, that's the kind of support we can give collectively as a group. So I'm
Right.
glad you called that out in the presentation, so that way we can bring it up again, because I know now that we're in early March, I believe the legislative agenda will start kicking up again.
mhm.
I'm not really 100% sure of what the legislation calendar is for this year, but I do believe it starts up again pretty soon. So it might be a good idea as a group for us to identify this bill and a few other bills that we believe will be beneficial to the deaf community, and leverage our both House and Senate representatives for support to bring it up to the House for a vote, and or even if we need to tweak the language. So
Yeah.
that's something that we can try to get the ball rolling on again.
Yeah. And I also came up with a kind of like a proposal and another infographic I'd be happy to share with the health committee. I could, send to you and you could talk about. I would be happy to come again to talk about, but increasing awareness among the healthcare practice community, because many of the parents said, oh yeah, I think they would provide an interpreter if I asked, but they shouldn't have to be asking, or it should just be a given that, do you need access to communication? Does your child need access to communication? It doesn't seem like it should be this difficult thing that it is.
Right.
So I have a proposal that I wrote up and an infographic of how that, we could pass out to doctors' offices. So, because when I was doing the research, a lot of the literature said the doctors would be more likely to contact an interpreter if they had the information available. They just don't know how to go about it. So I made an infographic, like 1, 2, 3, 4, you know, how to do it. And so maybe if they had something simple like that, they could just keep in their office, they might be more likely to do it. Who knows?
Yeah, I'm happy to read up more on that. I know collectively, everybody did a little bit, excuse me, everyone did a little bit more frustrated with the lack of progress around the healthcare providers having readily available sign language interpreters, at least in the major hospitals, let alone the
Yeah.
doctor's offices, which
Right.
might be a little bit harder at first, but we need to try to improve on.
Yeah.
Look like Pam,
Yes.
you had your hand up?
You're muted, Simon.
So I wanted to say that, you know, it was really nice the fact that you've shared those videos from the deaf community of people sharing their experiences in their own doctor visits, stuff like that. That was very beneficial. I also want to let you know that one piece of information that might need to be tweaked a little bit is that I noticed that the use of VRI, okay, which is video relay interpreting, it really, when we talk about that, people are very confused about that. It really should be video remote interpreting, but not video relay interpreting,
Yes.
that terminology, because the other one, when you speak about VRS, is video relay service.
Right.
Okay.
Right.
So
Yes.
that's basically for, telephone communication for other purposes.
Right.
And it's separate. They each serve a purpose. VRI, you can use that service where you can use it in the same room, where VRS you cannot. And so that is a policy that was established by the FCC. So that would be very important. So when you tweak that, change that and present this information, change that to be video remote interpreting.
Yes, thank you. And I did. I did change it. It's just, I had my laptop all set up and it has that in it and it has a few other updated things too. And I can't get service on it. For some reason, it won't connect because I stayed at school because, you know, I live far and I used this other, I don't know, this is a little older presentation. So yeah.
And also I want to mention the fact that, when you speak about the caption for Nathan, he made that comment. I know that the caption is also put down relay. So you need
Yeah.
to captionists know that as well.
Yes.
So type that word in there.
Yes.
Mo is
Thank you. I will. Yes. Always
Caroline,
good to have feedback. Yeah.
So, hi, Caroline
Hi.
Albert. Hi. So I have a comment and then a question.
Sure.
My kids are hearing, so when they got to a certain age at the pediatrician would have them in the room separately with the doctor, and I was not invited in.
Right.
And I know, and I was just thinking, that's right. And so the point about not knowing your medical history was never dawned on me. So that was very helpful. Thank you.
Yes.
My question is, are there interpreters who specialize in pediatric medical interpreting? Because I would think that would be very different than interpreting an adult medical appointment.
Well, that's a good question. I don't know.
Yeah, me either.
That's a good question.
Okay. I wonder, Christine, do you know?
Hi. Yes, I do know that there are some within Rhode Island. I'm not sure, but I know in metro areas like Boston, for example, there are some staff interpreters who have worked at, say, Boston Children's. And so they have that specialized knowledge of interpreting in pediatric settings. So yes, I would say those are specialists. Yeah.
Yeah. And how can we get them to come to Rhode Island?
Yeah.
We're working on it. We're working on it.
I know. Thank you.
Thank you.
Christine.
I just wanted to say a big thank you to Penny. I know when she was doing this project, she reached out, she learned about HSTP, and we've been in communication about this project. And yeah, I think it's a necessary discussion to have. A lot of our work focuses on those who are age 18 and above, so the adult population. And so to have this presentation added to our discussion here within the committee, I think it's wonderful. So I just want to thank Penny for being willing to come and share all of the work that she's done on her project. And I don't know, Penny, if you also wanted to add about your preceptor, because I think that's a really good point to make, because I'm sure throughout this process, you've provided some awareness to her as well, and where she might be able to take that in the future.
Yes. So that's so there's so much, it's just trying not to monopolize everyone's time. So huge shout out to Christine West also for all of my questions. What do you think about this? Is this interesting? Is this the right perspective? And so thank you, Christine. I really appreciate all of your guidance. And so for nursing school, it's like a clinical, they call it a practicum, but because of COVID, there aren't a lot of sites open. And so and my school is online anyway, so they allowed me to do it this way. And so my preceptor is Linda Mendonça, and I don't know if you know her, but she is the Rhode Island State School Nurse Consultant. And she is going to be the president of the National Association of School Nurses beginning in June. And so she wants me to write it all up, and so it can be shared nationally, so that nurses throughout the whole country can have an awareness when they come across this situation, to inform the parents. And also I learned throughout the research that this is not only happening in Rhode Island. This is not only happening in New England. It's the whole country. It's the whole world. It's really a big problem. So we're going to do what we can here to help.
Yeah, it's definitely eye-opening, and I think it might be more of we might be able to convince people more in legislation and
Yes.
with employers that,
Yes.
okay, children also here are feeling frustrated, talking about 6, 7-year-olds all the way through
Right.
18 who
Right.
want to use their voice, but they're being limited by their own family or their own pediatrician.
Yes.
Where that's a place where we feel we can where we really should feel we can be able to ask any question or talk about anything, because they're protected by HIPAA and patient doctor confidentiality, but they're not getting that same benefit as our hearing friends and family and people that we know. So
Right.
that might be something worth exploring.
Oh, definitely. And, doctors are just so willing to use the parent or the family person as the interpreter. And, which we know they don't have the skill. They have surface skill. They don't know the complexities of the language, and they're not really getting the point of view across. And a lot is getting missed.
Yeah, I mean, speaking from personal experience, I can definitely attest to that.
I'm sure you can. Yeah.
Yeah, and then you could see from David and the athletic director
Yeah.
as well.
Right.
And that's just a few people that we
Oh,
know.
yeah. It happens all the time. I get a student, and especially before COVID, when, they were very active in sports, and like they're a star on the team, and the parent goes and makes an appointment for them, and they don't even know that they have a game, and the student is so frustrated. So it's just, not good.
Yeah. And please keep us in mind if you need any type of support or advocacy. If there's anything or any suggestions that come up at the committee, we can provide support, and even the Commission for the Deaf and Hard of Hearing, that we can try to provide support, communication to the deaf community. Please reach out anytime. And we definitely love to have you again in the future to have more conversation on how we can improve that for the children in our community.
Great. Well, I'd love to share my proposal with you. So just, let me know how you want me to do that.
Yeah, I appreciate that.
Okay.
And then I will, are you okay if I use some of the bullet point for the meeting minute that I include?
Oh, yeah. Sure.
Yes, thanks.
Sure.
Great. Christine?
Penny, I was wondering if there was any way that HSTP, in our work with medical providers, we're designing a series of virtual trainings for them. And the presentation that you just gave was fantastic. And I was wondering if there was any way that we could use that presentation to show the medical community across the state, to include that amongst the others that we have.
Absolutely. But let me get you the updated one.
Okay, perfect.
Yes. Yes, I'll just send that to you. Sure. Yeah.
Thank you.
Jane?
Hi, Jim.
Penny, it's
I'm
good to
so
see you.
excited to see you. How are you?
I'm good. I'm good. And you got my mind going like crazy because that was such a wonderful, well thought out presentation. And it's what we all know, but sometimes we just need to be reminded of what we're dealing with on a regular basis.
Right.
And so one of the things that, I keep thinking about, how could an agency like Perspectives also help with parent education? We're doing work in early intervention. We do home-based services, and we're often working with parents at a very early time to really start to talk about things like this, like what's going to happen when your child's 16, 14, and they want to talk to the doctor and that sort of thing. So again, I love the idea of taking what you have and seeing, other ways, other stakeholders too, not just Perspectives, but thinking about RIPEN or thinking about other organizations to really help with the family education piece. Parallel and tangent to what's happening with the medical community. I think that would just be a wonderful thing.
Yeah, well, it would be great. I can share the infographic with you or whatever part you'd like. But I think the more people that are aware, the better.
Yep.
Because what happens. The parent calls the doctor and the office person says, "Oh, hi, how are you? And you need an appointment." "Yes, I need an interpreter." "Oh, that's your responsibility."
Yep.
That they're going to say that.
Absolutely. And especially when it's minors.
Especially.
Right.
And the parent says, "No, that's not true. It's the law. It's your responsibility." "Oh, no, you take care of that." No. And so it's right there in steps that it's their responsibility, and the website to contact, the number or the email, whatever, whatever mode of communication they want to use. And it's their responsibility. So
Absolutely.
I am so happy to tell them. I don't, I'm not shy. So yeah, I'll send you whatever you'd like. Just let me know.
Great. Thank you. Great work.
Sure. Good to see you.
Good to see you.
Thank you very much. Anybody else have any question or comment for Penny? Going once, going twice. And I really want to thank you for your time, Penny. It was very, very informative, and I love the testimonials from your colleagues who have experienced it themselves And it's always very good to get the type of feedback, and as a community, how we can come together to educate the parents and educate what kind of right the students have in the doctor's office, and even educate the doctor's office and hospitals on what they should provide to the community.
Right. I really think that's where the work is. Educating the medical community.
Yeah.
Yeah.
Absolutely.
All right.
And,
Thank you.
Well, thank you, Penny. And
Okay. Thank you.
with that, we can move on to the next topic. But before we do that, just want to check and see, Diamond, how you doing? You okay? You want a few minutes?
I'd like to keep going because I have to go pick up my daughter after this. So I just want to keep going if that's all right with you.
Okay. Are you sure you're okay with that? All right. Okay. The next part of the agenda is we want to have some time to talk about progress update. If there's any topic or update that we want to share today related to the healthcare committee and the HSTP project. And here's Christine. How are you?
Good, Brett, how are you? What we had planned tonight was to share at least one of the surveys that we administered. And after Penny's presentation, it's like the perfect segue to talk about the survey that we sent out to the medical community and to talk about the results of that. I know we're only scheduled till 5:30 and we only have about roughly 15 minutes left. And we're definitely not even going to be able to scratch the surface on that. So we do have both surveys, the results and the data ready to go. But I think the best thing to do is schedule another meeting and devote that time specifically to discuss the survey results. And tonight I can just give an update as to the project and where we are and answer any questions about that. And Alex too, please feel free to chime in at any time. So if that's okay with you, Brad, I think that's probably the best way to go about.
No, that's fine. Yeah, we can schedule a meeting, like a shorter meeting just for the update on the survey, if you a dedicated meeting for it.
Okay, great, perfect. All right, so in terms of HSTP for goal number 1, which is data collection, both of the surveys are complete. We have the results. They have been transferred to visual format, and so they're all ready to go. We have them in PDF format, we have them in PowerPoint format, and those will be included in the final consolidated report. And they will be included on the website, which, by the way, I finished with that few weeks ago, and I just heard word today that it's ready to go live tomorrow. So I just need to create a vlog for that, and that will be disseminated to the community. So that's been a long time coming, but the website is ready. So all we have left for Project Goal 1 is the consolidated report, and both Alex and I will be working on that. It's going to take some time. Included in that will be the results of the surveys, as well as any future recommendations and a roadmap for the future for the healthcare committee and for the community. So that's the only thing we have left for Project Goal 1. For Project Goal 2 is what Penny was talking about, which is education to the medical community. And so we have 12 virtual trainings that we're working on. We have about half of them already completed in terms of the raw footage. Alex right now, he's doing an incredible job on editing those videos, adding captions. We'll be adding the interpretation to them as well, and they're fantastic. I saw a few of them already, and they're amazing. He's done an incredible job with it. So we have 12 altogether. And those 12 trainings are Intro to Deaf Culture and Community. We have language acquisition in the deaf community. We have communication access in healthcare settings. We have working with interpreters, including deaf interpreters. We have legal requirements for effective communication. We have assistive technology in healthcare settings. We have resources in Rhode Island, all about RICDHH. We have a training on cochlear implants, deaf blind individuals in healthcare settings. Rhode Island Relay, mental health and in the deaf community, and behavioral health in the deaf community. And these trainings were created based on the results of the survey that we got from the medical community. So we identified knowledge gaps, and these trainings will address those knowledge gaps. And once these are complete, they will be included on our website. They'll also be sent to EOHHS, their healthcare workforce development division. And so we'll work with them to get CEUs, and they'll be disseminated to the healthcare community so they can get the education that Penny was talking about. So we're busy with that, and that'll take us quite a few months to get those virtual trainings fully edited, captioned, voiced, interpreted, and then ready to post. Once those are done, project goal number 2 is complete. We still will be working with the accountable entities, so the different hospital systems across the state, to provide some trainings as well, so Zoom trainings. So that's goal 2. And then most of the work has been spent on the interpreting program. So first of all, I want to thank Marie Lynch. She's done a lot of work on the interpreting program, and it's quite a task. There's a lot that's involved, and the advisory group has been meeting diligently every 2 weeks. We had a 4-hour retreat a couple of weeks ago, and Ernest was involved as well. And we've done a lot of work. We've been working on program goals, program competencies, program experiences, program assessments, you name it. So there's a lot that goes into it. Marie is very well versed in program design and what's called kind of reverse engineering or backwards design, meaning you set the goal that you want to accomplish. You establish this concept for the program and you work backwards to accomplish that. And there's a lot of steps involved. The program also has to go before a post-secondary education council. And so there's a group of individuals at Rhode Island College who have to approve the actual program. And that's going to be taking place next Monday, March 15th. So a proposal has been sent to them. And we've also received letters of endorsement from various hospital systems that are in support of this interpreting program. So the sign language interpreter program will be proposed. In addition, there's an interpreter program for Spanish interpreters and Portuguese interpreters. So all 3 programs are being proposed to this post-secondary education council. So we should have some idea of its approval by next Monday, Tuesday at the latest. Other than that, as Marie mentioned the last time we met, the format for the actual program is a 1-week residency in the summer and then a 9-month online program to follow. We originally had decided to have the week-long residency in June. However, we did push it back till August. And we did that because it's more likely that we'll be able to meet in person. Whereas with June, with COVID, we still don't know whether or not we would be able to meet. So pushing it back to roughly the 3rd week of August is more likely that we can actually meet on campus for a week. And then after that week-long gathering, folks will continue on for 9 months, completing the course modules for the program. So it's coming together. It's quite a process given the time frame and giving the funds. So we're doing the best we can, and we look forward to this taking shape. So we're really excited about it. Ernest?
Thank you.
Yes, thank you, Christine, for the update on the program. I just want to make a few announcements this time. I just want to give an update about the vaccines and historically what's been happening with vaccines. I've been working with the Rhode Island Department of Health, working out information and making that information available in blogs with interpreters and with closed captioning. And right now, you know, the discussion that we're having right now is that many deaf and hard of hearing people who are going for their vaccines are still experiencing struggles with the communication barriers and so forth, because there's a lot of communication taking place during that vaccine. And so with the doctors and nurses and so forth, they want to know about the type of shots they're getting. People are asking questions about the second shot, but that duration of that meeting only takes 15 minutes. So within that 15 minutes, we really feel that there should be an interpreter there. So I've been having meetings with the Department of Rhode Island, Department of Health, to see if we can make arrangements for interpreters to be there, so that when those deaf individuals come, that their questions can be answered, through an interpreter. So what we'd like to do is host an event, but we're afraid to have it for one day, just for the deaf community, because the turnout might be slow. And I know that the vaccines, there's a lot involved there in terms of prepping the vaccine and having them, taken out and administered. And so we want to have a turnout where there's 300 people coming, not just 50. So right now, Michigan, my home state, and a few other states have set up a date for vaccines, which is basically known for Deaf Day only, where the deaf and hard of hearing are having it. And those shots are being administered at the school for the deaf, and people are going into that place. So that means that those shots are not available for the public, only for the deaf and hard of hearing community to go straight into the school for the deaf to get those vaccine shots. And the communication is already taking place because it is a school for the deaf after all. So we want to follow that same model that some of these few states are doing, and hopefully maybe we can do that here. And that also will allow not just for the students and the frontline teachers, but also for the deaf community with the senior citizens, people with other intellectual disabilities, everybody that's using, sign language or hard of hearing that rely on interpreters for that event. Okay, so because the two states have been using it, it was suggested that maybe we should perhaps do the same thing. So we would like to do the same thing in Rhode Island, or if it's not done at the school for the deaf, we'll have it at a location that we'll have an interpreter there. But the point we're trying to make is that we wanted to have it so that it's only for the deaf community. And so this way we can disseminate that information so that the deaf community would be aware of it. So I'm actually going to be setting that up, a meeting with the Department of Health tomorrow to see if we can go with that. And so they have a few options. We can do it through the VRI, or we can do it with a live interpreter. And so we're going to have that discussion tomorrow, and I hope to get an answer. So I also want to get your feedback on that right now. And so after this meeting that I have tomorrow, I'll be reaching out to you, and then hopefully I would like to hear from all of you in terms of what questions or concerns that you may have. I'm a little leery about using VRI. I know that a lot of people want to use that because it's a cost savings, but if having the interpreter there and then all of a sudden the turnout is very low, that's not going to be very good. So what we want to do, basically, that's the pushback that the hospitals are giving us. They're saying that the turnout is too low, and it's not, a good idea to have that. So I want to make it so that we can get the word out so that everybody can come. So this is a back and forth that, there are pros and cons. I understand where they're coming from, but I am meeting with them tomorrow, and I'm going to continue to push for having a deaf day for all the people in the deaf community to get their shots. And then there's going to be more questions and stuff. I would like to share that with you. But I would also depend on everybody on this committee to get that information out so that, people can be aware that they can have access to the vaccine shots, hopefully with an interpreter there on site.
Making sure I was on mute. Thank you for your input, Anna. I really appreciate that. I'm trying to find my captioning. Can't. All right. Are there any other updates? So it looks like Christine and Ernest have shared their update. I appreciate your input. I will definitely schedule another meeting to talk more about the survey result that Christine got back. I know we're all really excited to hear about those results. It was quite a comprehensive survey, and with Gallaudet's help and Christine's direction, definitely looking forward to it. Yeah, Christine.
Thank you, Brett. For the next meeting, I think I'll report out on the deaf and hard of hearing survey, and I would love for Alex to have the opportunity to report out on the survey that we administered to the medical community, because I know he did a lot of work on that. So
Okay.
we'll both probably need
Yeah, I'll make those two meetings the main objective of the meeting.
Perfect.
And how do you two want like a half hour each, or like an hour each, or 45 minutes each?
Alex, what do you think? I think for mine, I'll probably, for the deaf and hard of hearing survey, I'm gonna say probably 45 minutes. Alex, what do you, how much time do you think you'll need for the
Well,
other?
if we want to go through each slide, you know, there's a lot of slides,
Yeah.
and we could go through each one. I figured I would probably pinpoint a couple that we can spend some time on, but I'd probably need at least that as well. It's because, you know, twice as long as the deaf and hard of hearing survey. I don't think we need twice as much time though.
Yes, I mean, we can try to, I mean, we can talk more about like, how do we want to put it in one meeting, or do we want to space it out? Like do it 2 weeks apart as opposed to waiting a full month. But yeah, we can talk more about it. I definitely want to allow you to enough time to be able to share your results and your findings. This is really important to the whole project. So I'll definitely reach out to you two, more specifically about that. Okay.
Okay.
I appreciate that. All right. For the that I believe it for the HSTP update, the project update, and we can move on to if there are any public comment. We have 3 minutes left. Want to give them time if there's any public comment that people want to bring up. I know a few people joined the meeting after we started.
I have a question for Christine.
Yeah, sure. May I ask who's speaking?
This is Bumi.
Oh, hi, Bumi. How are you?
Yeah.
Sure, go ahead.
Yeah. Do you know what is going to be the tuition for the interpreter program, or the school will have to determine that?
We're still in talks about that. We're looking right now at about, and this is not finalized, so I say this with caution, but right now we're looking at this 9-month program to be about roughly $1,500. It's a really good price considering interpreters who are already working and are eligible to participate in this program. They are required to earn CEUs, 8 CEUs every 4 years, so that's 80 hours. This program will give folks within 9 months 12 CEUs because it's 120 hours. And for $1,500, it's a really good price. So there's also scholarships that are available. And so we're still working on the criteria for who qualifies for scholarships and what those contingencies are. But it's a very affordable program, and it's right in line with NTID, RIT. They have a medical healthcare certificate program as well, and it's roughly about the same price. So it's a pretty good value, and we think that a lot of folks will find it attractive for that very reason.
Yeah. Thank you.
You're welcome, Ruby.
Thanks for your input, Christine. Any other question? I think Bethany mentioned we had some Zoom bomber that came in late. So that's why I thought we had more people in this meeting. But if that's all, then we can wrap up the meeting. I will put out a survey to pick a day and time that's best for everybody to meet again. Our next meeting will be focused on the survey results from both Christine and Alex, and I will reach out to them to talk more about whether they prefer a different meeting, so that way we can dedicate time for each one, or combine the two and make it a bigger meeting. With that said, I think that's about it from me. Any last words? No? All right. Well,
Penny is still there. I just want to commend her for a very great job, and thinking about the children. It's been a long time, a long thing that is overdue. Congratulations to her and thank you for doing that.
Yeah, definitely very helpful and very informative with a great presentation. And that's the kind of feedback that we really enjoy having in this committee. All right. Thank you so much, everyone. And I'll give you, well, it's now 5:31, so I can't give you any time back, but have a great night and enjoy this newfound spring weather. All right, take care. Bye, everyone.